Hi, everyone, and welcome to Empowering the Opposition. My name is Dr. Nafis Alam, and our topic today will be body positivity and holistic health. And we're going to be discussing if there's space for body positivity and holistic health to coexist with one another. Now, if you're listening to this, you probably already know about body positivity, health at any weight, health at any size. And it's likely that you have strong opinions in one direction or another when it comes to this particular topic. But here at Empowering the Opposition, our goal isn't to make your mind, it's to sort of give you the arguments, the validity of those arguments, the credibility of those arguments, going in different directions. So if we were to start this conversation from one point of view, we can essentially say, from a medical standpoint, that it is important to have some semblance of physical health. Obesity and the consequences of obesity are, they do exist, and they're essentially not disputable in many ways. If we look at some of the health consequences straight from the CDC here, for health consequences of obesity, we have all causes of death, mortality, high blood pressure, hypertension, high LDL cholesterol, low HDL cholesterol, or high levels of triglycerides, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea and breathing problems, many types of cancers. It also goes into the low quality of life, which kind of sounds a little subjective there. Mental illness such as clinical depression, anxiety, and other mental disorders, body pain and difficulty with physical functioning. Now, some of these consequences are disputable and others are not. And we'll go into the ones that are not. So these, from medical data, we have seen higher blood pressure. We have seen higher bad cholesterol and lower good cholesterol. We have seen higher levels of type 2 diabetes, heart disease, stroke, gallbladder disease, osteoarthritis. But when it comes to things like quality of life and mental health, it may be up for interpretation just because of the fact that those consequences may not be directly related to being obese. Rather, the societal pressures people who are obese may feel as they're operating and living their lives. So if we were to empower the opposition and go against the idea that physical health is important, we may want to separate physical health from mental health. And in doing so, we could make the argument that those who are pro-body positivity favor their mental health to a degree that they feel better when they're not paying as much attention to their physical health. To not care about your body can be freeing from a mental standpoint. And let me just put it to you this way. Like if I go to the gym and I go to the gym every single day, or let's say 5 days a week, for 4 or 5 months, and then I get injured and I'm out for a good month because of that injury, I will likely have greater mental health issues than someone who has never gone to the gym at all during that month that I'm out of commission. We can't really, discount that because it is a habit, going to the gym and working out and paying attention to physical fitness. And then, we also can't discount the fact that, someone who hasn't had that experience would feel just the same about themselves. Now, let's say I'm out of commission for a good month. And over that course of that entire month, because of the fact that I haven't been going out and working out and things like that, my aesthetics look a way that I did not expect them to look, that I did not want them to look. And now I may look in the mirror and become discouraged about having to do all that work just to get back up to where I was before, just a month ago. And I could also be fearful of going into the gym because I might be afraid that I'll hurt myself again. But at the same time, I know that if I don't work out as hard as I was working out before, I'm not going to achieve the same kinds of results. you have to take into account the impact of mental health when it comes to body positivity. And ultimately, in my opinion, I think that's what body positivity is all about. It's not about not caring at all about physical health, because I think that would be a little bit of a strange and unfounded point to make, to say that, you could be 800 pounds and be perfectly healthy. It's just not a realistic statement to make. But can you be a few pounds overweight, not a supermodel look-alike, and actually be of greater mental health than someone who is a gym rat or a super athlete, let's say, or even an athlete, period, because the regimens are so intense? The answer there is likely yes. If you go to the gym every now and then, if you are paying attention to what you eat and how you work out occasionally enough that it is a part of your lifestyle, but not so much of a part of your lifestyle that you feel lost without it, it's likely that your mental health is at peak form. And this compared to people who are never going to the gym and do not care at all about their physical health, and those who are going to the gym every single day or 5 days a week, just, intense workouts all the time, because there are mental health topics to be considered for those folks as well. What if they were to miss a day? I remember, speaking for myself, when I'm thinking about going on a vacation, the second thing that I look for after, making sure that it's a nice warm climate where I can enjoy a little bit of sun, the second thing that I look for when I'm on Expedia or something like that is the quality of that gym. I'm on vacation. Why is that the second thing that I'm looking for? You could make an argument that if the gym isn't up to par, then I'll probably go to a different place on vacation. In fact, you wouldn't have to make that argument. I know myself, and I know that I would go to a different location on vacation if the gym isn't to my liking. The fitness facility, let's say, isn't to my liking. And thus, I might be missing out on the best vacation spots just because of this particular qualifier. So, in many ways, those who are so focused on having fit bodies, making sure that they do not have any more than 50 grams of carbs per day, making sure to stay away from sugar, making sure to not have any carbs except fiber beyond that 50 grams. This is a lot to consider. And that means that if you're going out, if you're hanging out with some friends, you might not be able to enjoy the same things that they're enjoying. And what does that do for your mental health? I think you know the answer to that question. It's not good for your mental health. You might be saying to yourself, yes, I might be the fittest one out of my friends, but they seem to be having more fun. Let's consider that for a moment. I may be fit, but you are having more fun. One is about physical health. The other is about mental health. Not saying that all kinds of fun are congruent with mental health, but there is a correlation between having fun, enjoying life, and being in good mental health. That's pretty much as common sense gets. So if you want to think about body positivity and you want to think about holistic health in such a way that both can coexist with one another, it's with the understanding that it's never to any one extreme. You wouldn't just completely disregard physical health and eat everything and anything you want with oils and butters and fats and carbs and all that stuff, and making sure to never be as sedentary as possible. You wouldn't go in that direction and find peak mental health. But that usually goes without saying, and that's usually understood. But on the other end of the spectrum, those athletes, those fitness freaks, you could make an argument that they're not in peak mental health either. And perhaps they could stand to be a little bit more body positive in saying to themselves, looking in the mirror and saying that, I'm fit, I'm fine, I can enjoy a night out, if I don't personally drink, as many of you already know. But if you say, this tonight I'm going to go out drinking with my friends, I'm going to go out and have have like pasta with my friends and have some carbs and sugars and stuff like that, just to be able to have a good time and enjoy myself and not worry so much about what I'm putting into my body. Maybe tomorrow when I wake up, I'm going to feel sluggish and I'm not going to force myself to go to the gym. I'm not going to retrospectively hate myself for going out tonight and drinking and eating pasta and eating carbs. I think that is what leads to peak mental health, is paying attention to your physical fitness, but leaving enough room to allow yourselves to, I would say make mistakes, but this isn't a mistake. In fact, if it's good for you, how can it be a mistake? But instead, allowing yourself the opportunity to deviate from the plan that you have going for you, and then return to it when it's appropriate for you, because mental health is important too. And I think that's where the body positivity movement is so valuable. A lot of people, with the whole empowering the opposition thing, they'll demonize the body positivity movement and say that this is all about fat acceptance and people, not being physically healthy. That's one side of the argument as far as like going to that particular extreme. It's really not. And other people would think of body positivity as being the best thing ever, and it's an opportunity to, to really love yourself as who you are. It's somewhere in the middle. You want to love yourself enough to be your best self. You want to love yourself enough to be your best self. And I don't mean that just from a physical standpoint. Hopefully you do want to be the best that you can be physically, but not at the expense of your mental health. And hopefully you do want to be the best that you can be from a mental standpoint, but hopefully not at the expense of your physical health. When you put everything together, the best version of you, the best version of me, is probably not the most physically fit version, nor the least physically fit version. It's somewhere in the middle, where we have a good combination of physical health and mental health. Well, that's all the time we have for today. I'm Dr. Nafis Alam, and this has been Empowering the Opposition. See you next time.